This is Kim Newlove, host of the Pharmacist Voice podcast. I am a pharmacist by training, but I made a career transition to voice actor and podcast host. Among other things, I narrate audiobooks for women pharmacist authors, provide medical narration to clients in the pharmaceutical and biotech industries, and narrate content for explainer videos and e-learning projects. I was inspired by my nonverbal teenage son with autism to combine my background as a pharmacist with my speaking voice and launch my voiceover business, The Pharmacist Voice, in 2017. My son Kraig helped me realize the power of having a voice and using it. My solo podcast episodes are about some aspect of being a pharmacist, a voice actor, a pharmacist podcaster, or my career transition from pharmacist to voice actor and podcast host. My interview shows feature a variety of people who use their voices to advocate for something, educate in some way, or entertain so that you will be inspired to use your voice too. This is episode 146, and you can find the show notes with links to anything mentioned today on my website, thepharmacistvoice.com. You can also find my medical narration demo and a link to my online course, Pronounce Drug Names Like a Pro, on my website. That website again is thepharmacistvoice.com. Dr. Christina Madison, founder and CEO of the Public Health Pharmacist, PLLC, a public health consulting firm, returns to the Pharmacist Voice podcast today for a very different kind of interview. You see, as I publish this, it's April 22nd, 2022, and April is Autism Awareness Month, or Autism Acceptance Month. Christina usually uses her voice as an advocate for public health, of course, vulnerable populations, the underserved, victims of human trafficking, vaccines, HIV prevention in the LGBTQ community, gender-affirming care, and more. Dr. Christina Madison and I are going to talk about autism. Why would a couple of pharmacists talk about autism? Because Christina and I each have a son with autism, and we use our voices as advocates for our children. Christina's son Alex turned 6 just a few days ago, and my son Kraig is 19. Christina and I have known each other for a couple of years now, and we have definitely bonded as autism moms. We are advocates for our sons with autism, and we share a lot of common ground. So, in honor of Autism Awareness Month here in April 2022, we are opening up as pharmacist moms of children with autism. Not only will you hear us talk about the struggles of being working mothers of children with autism, but you'll also hear us talk about the gifts of autism. There is definitely a silver lining. This is a great episode for anyone who wants to get to know and understand Christina and me better and/or learn about autism. Having a child with autism has been one of the biggest challenges of my life. But thanks to friends like Christina, I know that I don't ride the struggle bus alone. And it's okay to be vulnerable on a podcast episode and share that. This is why we use our voices. Someone listening to this today needs to hear us. Please feel free to share this episode. Now, in next week's episode, which will be episode 147, that'll be a solo episode, I'm going to give a brief recap of the major talking points from our interview. My son's challenges in life as a result of his autism have changed my life, and I want to use this opportunity to share what I wish a mentor would have shared with me when my son was first diagnosed. I didn't know anything, and learning the ropes was like drinking from a fire hose. It wasn't funny, but that mental image sure is. I know it can be overwhelming. I've been there. So join me next week if you want to hear more about autism, my son's challenges, how it changed my life, and the major points from this interview today. There is a lot. It is 64 minutes of Christina and me talking. You're going to love it, but it is a lot, and a recap can be very helpful. Now, before I share our interview, I just want to give some background information about autism and some stats. We're pharmacists, we love stats, right? Here we go. Oh, and by the way, most of this information comes from 3 organizations. Links to all 3 of them will be in the show notes, but real quick, I'm going to list them here. 1, Autism Speaks. 2, the Autism Society. And 3, the Centers for Disease Control and Prevention, otherwise known as the CDC. What is autism? Autism refers to a broad range of conditions characterized by challenges with social skills, repetitive behaviors, speech, and nonverbal communication. Autism is also known as autism spectrum disorder, or ASD. There is not one autism, but a spectrum, or subtypes. The exact cause is unknown, but research suggests that a combination of genetic and environmental factors are involved. In 2013, the American Psychiatric Association merged 4 distinct autism diagnoses into one umbrella, which is called autism spectrum disorder. The 4 are 1. Autistic disorder, 2. Childhood disintegrative disorder, 3. Pervasive developmental disorder not otherwise specified, also known as PDD-NOS, and Asperger's syndrome, which you've probably heard called Asperger's. What are some features of autism? Developmental delays can appear early. Developmental delays are definitely a feature of autism. Once those delays are identified, though, early intervention can very much improve outcomes later in life for people with autism. True story. My son is 19. He's gotten a lot of early intervention. Each person with autism has strengths and challenges. There's a range of how they think, learn, and problem solve. Some require significant support in their daily lives, while others may need less support and, in some cases, live entirely independently. And that's what we all want for our children. High-functioning, living independently. Some individuals on the spectrum have sensory sensitivities. Sometimes I think this is called sensory integration dysfunction, or SI dysfunction. The senses, of course, are sight, touch, taste, sound, and smell. Some individuals also have medical issues. Seizure disorders and sleep disorders, anxiety, depression, and attention issues sometimes accompany autism. Now on to the stats. Here's some statistics and insights into who is affected. Here we go. Most children are diagnosed at the age of 4, but it can be reliably diagnosed as early as age 2. Signs usually appear by the age of 2 or 3. According to both Autism Speaks and the U.S. Centers for Disease Control and Prevention, about 1 in 44 children in the United States has been identified with autism spectrum disorder, according to 2018 data. It affects 1 in 27 boys and 1 in 116 girls. Autism spectrum disorder is approximately 4 times more common among boys than in girls. Autism spectrum disorder occurs in all racial, ethnic, and socioeconomic groups. Minority groups tend to be diagnosed later and less often. Early intervention makes a big difference, and there is no medical detection for autism. Now that you've heard some background and some statistics, here's my conversation with Dr. Christina Madison. Hi, Dr. Christina Madison. Welcome back to the Pharmacist Voice podcast. How are you?
I am fantastic. Thank you so much for having me.
Oh, you're welcome. It's great to have you back on the podcast today for hopefully a little longer interview than last time.
Yes, that was slightly abbreviated, but no less impactful.
Right. It was a good interview. If anybody missed that, I believe that was episode 118 of the Pharmacist Voice podcast. We were at the Metapreneurs Conference in Cincinnati, Ohio in October 2021. And today we will be talking about our experiences with autism because we are both parents of a son with autism. Isn't that right, Christina?
Yes. So my son, who is almost 6 years old, was diagnosed when he was almost 3. And so, he was having some trouble meeting his milestones. And, obviously, as new parents, he's my first child. I have two. We didn't know that this wasn't typical. And so, as new parents, you try your best, and we knew something wasn't quite right, but we didn't know exactly what was going on with him. And so I think that mom's intuition, knowing something's not quite right, asking more questions, and then, getting him into early interventional services, I think was really helpful early on in order to help him meet and, at least try to make up some of those, deficiencies that he had, especially as it relates to communication.
Yes, communication is one of those hallmark traits of people with autism, communication difficulties. Your son is almost 6 now, is that right?
Yes.
And what age again did he get diagnosed?
He was almost 3. So we got him early interventional services right before he aged out of the program. And then again, got him therapies. So for those of you who are not familiar with some of the therapeutic interventions that children on the spectrum typically require, they usually require speech, feeding, occupational therapy, physical therapy. And so when you have a younger child, depending on when they met their milestones. So my son met a lot of the physical milestones, but had those like cognitive declines, in particular in the area of speech and communication. So he reads, he writes, multiplies. He exceeds his peers in some of those other areas, but it's that communication piece and the comprehensive piece that is still really challenging for him, as well as the fact that something else that's very common for kids on the spectrum is they usually have a very limited diet, or they have challenges with eating. So my child has a lot of oral aversion. So he had an allergic reaction to hummus when he was 2. And that
Hmm.
like really altered his ability to eat, because he looks and views food as the enemy, like food is going to hurt him. So we've really had to do a lot of work with like desensitizing him because of those sensory issues, around feeding and eating. So that's a common issue with kids on the spectrum. So they'll exceed in one area but have deficiencies in others.
Right. I have similar experiences with the feeding issues. My son chooses to limit his diet, although he never told me. He just shows me, right? He doesn't exactly say, Mom, I won't eat vegetables. He just shows me, I will not eat vegetables. I have to sneak them into rice, cheesy rice, or I have to sneak them into lasagna or pizza. And I don't know about you. Do you hide vegetables and things in your son's food too, or does he just eat them?
So my son he has a very, very limited diet. So I actually have to like fortify what he does eat with like protein, and like we supplement with like vitamins and things like that because he has such a limited diet. So he eats like soft foods. Like he doesn't really eat a lot of solid foods right now. So again, that's something that we're working towards. He used to, eat those like baby food pouches, and we had to like get rid of those because it was like putting us in the poorhouse because each one of those little packets is like $2 each, and he would eat like 5 or 6 of them per sitting. So we had to figure
Oh,
out
wow.
like we had to figure out other options. So he eats a lot of like he eats yogurt, so we'll mix things within the yogurt, and we like do a lot of protein shakes for him that are fortified, that have other things so that he's not deficient in some of those vitamins and minerals that you would typically get from your diet because he doesn't eat those things. And then, now we're like working on that oral aversion. But for the most part, I always tease and say, I have no idea how my son is like growing so quickly. And he's super tall. He's in like the 80th percentile for his age and height. but he's on the thinner side because he doesn't eat very much. But I'm like, he lives off of air and prayer
Oh,
because the kid doesn't eat much. And I'm like, I have no idea how this kid grows because he eats very little. But it just goes to show you, like, humans, like, we evolve. Like, I think we, he knows what his body needs and he eats only that. So, it's as somebody who comes from a upbringing and a family where, like, eating and food is like a demonstration of love. It was really hard for me to have a kid that didn't eat.
yes. And I keep waiting for you to quote Yoda here. Do you know what I'm going to say next?
I don't.
Yoda said something to Luke Skywalker. He was eating his food or something, Luke Skywalker's food in I can't remember which Star Wars movie. Forgive me, whoever's listening that's a Star Wars fanatic. But Yoda says, "How you get so big eating food of this kind?" I can't do a Yoda voice, but
Well, that was
yeah, I
pretty
know.
good. That's pretty good, actually. I'm a big Star Wars buff, so that was actually pretty good.
Yeah. But that's true. Sometimes I looked at my son who's now 19 and I thought, "Oh my gosh, how are you even growing eating, chicken nuggets or" he used to love corn nuts for some reason. It was extremely crunchy and extremely salty. It's a really processed and very bad for you type food, but it was one of those things that if he saw it, whoever had it, father-in-law, or if we brought it into the house, he was all over it. He just loved it.
And maybe that goes back to the whole sensory issue. So I don't
Mhm.
know if your son does this, but they do calming behaviors and they do, things to help self-soothe. And so I'm thinking, from a sensory standpoint, maybe that was helpful to him because the crunching and, there's something to that maybe.
Yeah, maybe it made him feel tired. Sometimes they enjoy being tired, so they don't sleep until they are extremely tired, or they keep eating something until they feel full. And that's something that's actually persisted with my son through adulthood here. He cannot tell when he's full, so he wants to keep eating and eating. And we've come up with this phrase: "You're not hungry, you're just bored." And we try to tell him, drink something instead. You're probably thirsty, or eventually the message will get through. But you were talking a little bit earlier about communication delays. My son's speech therapists, he's had many over the years because they come and go from different practices. And I remember they taught me that he has expressive and receptive language delays, which I had never heard those terms. We're pharmacists, we don't know these terms. So the expressive is where he talks. The receptive is where he receives that communication. He's following instructions. He's, listening to cues from his environment. And he has both those delays. In fact, he is 19 and he still cannot read, write, or speak. And his receptive language, although he listens in real time now, it used to take him 6 seconds to hear what I said. But the receptive language, if it's something familiar within a routine, like take this and go to your room, he's good. But if it's something that he's never heard before, he really has to work at it. And often he does not understand. Does your son have anything like that too?
So as far as the receptive, he's very good with the receptive. So, like, he follows directions very well.
Good.
Like, if he gets distracted, like, you can redirect him pretty easily. It's the what did you call it when they communicate when they're speaking? What did they call that? The
Expressive.
expressive. Thank you. So the expressive language is what he really struggles with, and so one of the big things for us, especially when we were kind of going back and forth between sending him to school or not, was worrying about him being able to express to F if something happened to him, like if he was hurt or somebody hurt him, like him being able to express that, or even just being able to get his basic needs met. So he's potty trained, all that stuff. But like, I don't know the people that he's with. And so, like, that was kind of a little bit of a fear because I was, like, worried that he wouldn't be able to tell me if something happened. Or, like, a few weeks ago, he said he didn't want to go to school. And we were like, that's strange because he really likes school. And we were like, that's weird. So something that our school district did, and I don't know if you guys had something similar, where they did this, like, 5-day pause in order to kind of help with all the absences from COVID. So they
No,
did
I
this,
haven't heard of that.
yeah. So they did this 5-day pause where the kids didn't go to school for like a week in order to like basically get everybody who was infected through that the time frame, the window that they needed to be out of work or school or whatever, and then to help to try to reduce the number of infections. And so after we came back from that, and then after they had like a couple of days off, I think it was like an admin day or like how they have the teacher conference day, he just was like, I don't want to go to school. And we thought that was really odd. And so of course they like talked to the teacher and we said, did something happen? Because he's saying he doesn't want to go to school. And so we couldn't quite figure out what happened. But like, again, these are the ththings that I'm afraid of, is that he's not going to be able to tell me if somebody was mean to him or somebody did something to him. And so again, that's why we we really work on the language, because that expressiveness is so important. And I think my husband, I think, really said it best. It's like, we take for granted the fact that like we are all born with this like basic operating system, right?
Mm-hmm.
And that like it's like out of the box and like we're functional. Like we take that for granted. And then, with my son, he was not born with that basic operating system. Like we're having to give it back to him. And so it's like piecemeal, it's like, we got to give him the cartridge for like eating and like feeling hungry and knowing when to drink water. And then we have to give him the cartridge to like figure out what emotions are, and like, do you feel sad? Do you feel upset? Do you feel happy? Like that's my husband, he's a computer guy. So he's like, he just didn't come with the operating system. Like he didn't have an iOS. It's like he didn't have an iOS, like, which is like hilarious to me. But it's such a great like comparison, because I think we, as just in general, I feel like we take for granted waking up in health and being healthy and being well. And then also taking for granted the fact that our children are going to be free of any kind of challenges, right? So like it was not, I have never had anyone in my family that has had special needs. And so it's really humbling, especially because of the fact that, just like you and we speak for a living. So
Yep.
to have a child that has trouble speaking, it's almost like a personal, like I almost feel like it's a personal weakness of mine. And I struggle even still to this day talking about my son's diagnosis because of embarrassment about it. And because I somehow feel like, because I carried him for 9 months, that ultimately I'm the one who caused it. And I think a lot of parents with kids that have special needs, especially the mom, have struggles with that. And so I just want to address that for a moment. And again, it's still something that that I struggle with and have challenges with. But over time, and my child's almost 6 years old, and it's taken me this long to talk about it publicly, right? And even just the fact that like when you asked me to do this interview, I was slightly hesitant to do it because I didn't know if I wanted this information to be out there about me. But I also know that this is a struggle. It's a struggle for parents with kids that may not necessarily be on the spectrum, but maybe have ADHD or have mental health problems or struggle with their sexual orientation or their gender identity. There are so many different things that our children can struggle with that may impact us as parents and how we feel we are parenting, that I think we need to have more awareness about, because ultimately we need a community. We need other people to understand that they're not alone.
Absolutely. You brought up some marginalized people, some people who are in the margins that we don't always include with the mainstream everybody else. People with challenges, developmental disabilities such as autism are included in those marginalized people. One thing that I want to say is that they are people first. My son's not necessarily autistic. He's a child with autism, or now I guess he's an adult with autism. He's a person with autism. I think that it's important that we do talk about it and normalize that we do have children with autism and we struggle, and that's our normal. And our children struggle, but still, like you were talking about earlier, we're filling in the gaps. We're trying to help them be as productive and independent and intelligent as possible in spite of their disability. And I want to say thank you for being here today. And I know it's so brave of you to talk about this because I, like you, am in the public eye and we do talk for a living. And at some point, we come to grips with it, and our feelings about our children with challenges do change over time. So, can you tell me what are some of the changes in your thoughts about your son with autism that have changed from the time he was born until now?
Well, I think obviously, a lot of the challenges and the issues that he had didn't really present until he was probably around 20 months, which is very common. So usually, when you start seeing it, it's between 18 and 20 months is when you may start seeing some of the signs of developmental delay, issues around like, not having eye contact or, not being able to bond, those kinds of things. And so I would say, in the beginning, very much embarrassed, did not talk about it, didn't speak it. Almost like it was like a dirty word. It was like Voldemort, like it's the name we do not speak, like, like very much like, sorry for my Harry Potter nerdiness. But yeah, like that was really, for a very long time. And so what I did was I had another baby, right? Because I was like, he needs a friend. And yeah, right. And I actually, now looking back, I honestly think I had postpartum depression. And I was like, I was happy when I was pregnant. Let's get pregnant again, right? So like my brain was trying to cope with a baby that I knew something wasn't quite right, right? And so I'm like, okay, what should I do? Let's have another kid, right? Like that just seemed right. So my kids are 22 months apart, and I had the same issues all over again, right? So it was like there are parts and there are times where I feel like I was like an absentee parent because I feel like I was in this fog of like trying to cope, and I thought that having another baby would help me. And for a lot of things, it did. So his sister is a typical peer, and she's actually quite advanced for her age. She's 4. She speaks. She, is super active. She did everything early because she was trying to catch up to her brother. And so, if anything, it's actually really helped him because he has this typical peer in the house and he interacts with her very well, and that they're close in age. So that's been extraordinarily helpful. However, it was painful for me because not only did I likely have postpartum depression with my first, probably had postpartum depression with my second, and then I had complications after my pregnancy that landed me in the hospital and like almost died from sepsis. So there was like a lot of stuff happening.
Wow, Christina.
Yeah. And not to mention the fact that I was denied care. So it was like, the whole, Black women, high, pregnancy related complication, morbidity, mortality issue. Like I experienced that because I went to the ER and they thought I was medication seeking and I was in pain and they denied me care. And then I had to go back. And when I went back, I, at that point, had elevated cardiac enzymes, like was, full minute.
Stressed. Your
Yeah.
body was stressed.
Full minute, like sepsis, like had a 7-week-old and a 2-year-old with autism. So like, it was pretty horrible. And so, so yeah, for the very, very, very long time, we did not speak about it. Even just like my issue around having complications postpartum, I didn't talk about because again, it goes back to the embarrassment side. It goes back to the like I'm a healthcare worker, like I should be able to advocate for myself. So there's a lot of things that I just kind of kept to myself and I kind of buried because I was like, there's no one else is going to understand this. they're going to think it's my fault. There was a lot of blame, a lot of blame. And it took me a long time to come out of that, and be able to speak about it publicly. And then just the fact that like, when I would talk about it, I would have other people be like, oh yeah, like I have a kid on the spectrum, or like, oh yeah, my kid suffers from ADHD and like we have challenges, or, my kids suffered from depression from the time they were like 8 years old and they've been on meds, and, like all these things that I would never have known if I had not disclosed this challenge. Because I think, on the outside, everyone's like, oh, your life looks great. Everything looks perfect. Like, it's that Instagram life, that Facebook life where
The highlight reel,
the
right?
highlight reel, but nothing is authentic. Nothing is what you deal with on a daily basis. And I'm very blessed because my husband stays home full time with our children, but we had to make that decision because somebody had to be here full time. And when we made that decision, my son made leaps and bounds in his development. And so not every parent, not every family unit has that luxury. And so I feel extraordinarily blessed. And, I see his development. I see that he's getting better, but I was very much a Debbie Downer. You can ask my husband. He told me in the beginning, he's like, he's going to get better. He's going to get better. These are things that he's like, don't you worry. He's going to be talking in full sentences. He's going to be doing this. And like, he was the Mr. Optimism. And I was the like, yeah, doubtful, which is terrible to say out loud, but like, that was my internal dialogue. And it sucks because I was so negative because I just was like, oh, I did this. This is my plight in life. Somehow, this was, the Lord is, this was my punishment for something. I went through all kinds of things. Like, I mean, it's almost like a death, right? Because it's the death of the child that you thought you were supposed to have, and you have to mourn that. And when you get over it, it's freeing.
Mm-hmm. And do you feel like you are basically current in what you are thinking and how you are feeling?
Yeah, no, I'm in a much better space about it now than I was even just a year ago. I would say. Yeah.
Well, thank you for sharing all that. I know that you're being very vulnerable by sharing that. And I'll tell you, I have had some similar thoughts too, such as, what did I do to deserve this? And it wasn't the pity party so much as, like, seriously, is there something that I did in my life that I can attribute to this diagnosis? And, we've all made mistakes in our lives. And, you just dwell on that. And then eventually one day you do get over it. And more research comes out and more parents speak out about their feelings, and you realize they're feeling the same thing. Like, what did I do? Did I get a shot? Did I, eat too much fish? And then you look at all the evidence and you realize no, vaccinations do not cause autism. And that's something that I think you could probably speak more to. You've probably done a bit of research on that, being in the public health space. But then, some people will use anything they've ever done wrong or possibly on the line, and think, maybe I shouldn't have gone deer hunting when I was 19. People, they think of all kinds of stuff. And anyways, do you have anything that you wanted to talk about with vaccinations and autism?
Well, I think the biggest thing is that obviously that, that initial, Dr. Wakefield article has been, discredited, debunked. He's been basically, his license been taken away, like it doesn't matter. Unfortunately, it takes, once that bad news is out there, it's so hard to kind of, unpack that. And so unfortunately, we just have really seen a rise in the anti-vaccine sentiment. And it's not just in the United States, it's global. We've seen outbreaks in places like France where they had a huge anti-vaccine wave of individuals over there as well. And it kind of corresponded with changes in their political basically
Climate?
they had their political climate. So the individuals that were new, they had new leadership, and that new leadership was much more liberal with people having excuses to getting vaccinated and vaccinating their children. And so it kind of created this whole wave of people sort of saying that they had either religious exemptions or had some other kind of exemption to vaccination. And then you started seeing outbreaks of communicable illnesses that could have been prevented by vaccines. So, the first thing I would say is that ultimately, even when we found out that there was no evidence that thimerosal, which is a preservative that was being used in vaccinations, causes autism, because obviously that product was removed from all pediatric vaccinations. And even after that, we still saw an increase in rise in cases of new diagnoses of those on the spectrum. And so there's just multiple reasons why it's debunked, but we just have to continue to tell people that, thimerosal is no longer included in pediatric vaccinations. The article has been debunked. The physician who wrote it said that he basically made up his results. We just need to do a better job of communicating that to the public and talking about the benefits versus the perceived harm, right? And I do say perceived harm versus actual harm, because I think it doesn't matter how much we tell people that this may not happen. That is their perception, and perception is reality. So it's a perceived harm. And I think we need to focus a lot more on benefits, and we need to pick better messengers. So those who are creating the message, we need to have better messengers so that people are getting this information from someone who looks and sounds like them, and they're more likely to accept those health information.
Well, those are excellent points. Yes. And just for the record, there is no evidence that shows that vaccines cause autism. Would you agree with that?
100%. I would
Yeah.
echo that sentiment. There is no evidence, none whatsoever.
Hey, as the public health pharmacist, I think it's important that people hear it from you just as they are hearing it from me. It is a fact, and I don't want to turn this into a controversial conversation, but I do want to make sure that we touch on things that are trending, basically, because this is what people hear. And there's no one cause for autism. Some people think it's genetics mixed with environmental causes. Other people have different beliefs, but there are ways that you can treat it. There is no cure, but in treating it, you mentioned some different therapies. I think you mentioned speech therapy, and I can mention a couple that my son's been involved with. He's had occupational therapy to work on fine motor delays and helping with just daily routines, hygiene tasks, and things like that, that he's just unable to perform because of a lack of fine motor skills. He cannot write. I already mentioned he cannot read, write, or speak. Not being able to write can be improved by occupational therapy, both in the school and privately. I don't know about you, but I've spent a lot of money out of pocket with therapies. And just a couple more. We've done something called ABA, or Applied Behavior Analysis, and we've done play therapy. I could go on with some of the things that we've tried, but those are some of the more mainstream things. You mentioned intervention earlier. What are some of the interventions you've tried to help your son with?
So my son actually gets ABA therapy in our home 6 days out of the week. So, which is
Awesome.
amazing. And it's helped so much. Like, I would say by far of all of the therapeutic interventions that we've tried, ABA has been the most successful. And so we started off doing a few days a week, and then we started off doing a few more days a week. And then now we have a very aggressive schedule where he gets 6 days a week, and it's between 3 and 4 hours. And then he also gets feeding therapy once a week, which is, there's a lot of debate about whether or not that's really helping. But, right now, I mean, it's out of pocket. Like, I make too much money for us to qualify for Medicaid. And so right now, all of this is out of pocket. And my insurance covers very little of his ABA. So, we've done occupational therapy, we've done speech, we've done feeding, we've done OT, PT, play therapy. We've done all of it. But like I said, the thing that's been the most successful for us has been putting him in school, right? So he has that social, emotional development, and then his sister as a typical peer, and having ABA in the home. So that's been the most successful for us. Obviously, it's different for every kid, and
Mm-hmm.
based on what their delay is. And so I think it's understanding what the delay is, and then picking the therapy that's most likely to help bridge the gap, or at least help them to develop the skills to cope for the deficiency. And I think that's the other thing too. So a lot of kids on the spectrum lack sort of that emotional intelligence. So they don't like know like if you're happy or you're sad or if you're angry. And so those kinds of things can be learned, right? Like you can like, so I'll ask my son, you know, how are you? And I'll say, I'm fine, you know, but we had to teach him that. Like, you know, or like, uh, or like when somebody asks him, he needs to reciprocate and say, how are you, right? Like, so it's like it's a natural behavior for us, but for him it's like he has to script it. The other thing
Mm-hmm.
too is my son does a lot of echolalia, which is where he repeats the thing that you say,
Mm-hmm.
because he's trying to process, right? He'll repeat the same thing that you say because he thinks it makes you feel better, but then he won't process it.
Or some kids
So
find joy in it. They watch a
yeah,
movie and they just want to
yes,
repeat lines like
and
Home Alone. Do they
he
want to repeat
scripts,
lines from their favorite
yeah,
movie over and over again? Yeah.
yes, he scripts quite a bit, and so you know we do what we can. He loves music, so we try to incorporate music. You know, he plays with his sister, like so now he's you know like his new favorite movie is the Turning Red movie, the new Pixar movie. So like he's
Yeah.
super excited about that. He's like, mommy, let's watch May May, you know. So like so he's doing things that he never did before. Like he never had a favorite character because like that just wasn't part of his being, you know, and now he does, and he's like asking for things and doing. So I know that regardless of where he ends up, you know, my goal for him is to be functional, right? And to be able to take care of his basic needs, whether that's living with us for the rest of his life, which is totally fine, or if he's able to live with assistance semi-autonomously, that's our goal for him, right? And so
Mhm.
you know, it may be delayed, it may take him till he's 25, or maybe you know like it's not going to be maybe at 18 like other kids, but we are hopeful, right? And I think again I'm really going to you know plug early intervention. So like if you're a mom, if you're a new mom and you think there's something that's maybe not quite right, like get your kid evaluated, like you know, as soon as possible. And even if you think maybe you're a little bit crazy and you're like, I'm not sure if these are normal milestones, just take them. It's a free evaluation in most states. So just, you know, do it early before the age of 3, because that's when the early interventional services, that's when they age out. And then after that, then you can use your school district to help with some of the IEP stuff, which is the assistance program that they can get when they're in school. But ultimately, you know, if you don't ask, you're not going to receive those services. So, and you need to advocate for your kid. So, if you don't ask for it, they're not going to give it to you. So, that's the other thing, too. It's like, here's your IEP, here's all your stuff. But, like, if you don't specifically say, hey, my kid needs help with this, this, and this, they're not going to include it. Like, you have to tell them. So, you also really need to advocate for your kid and find out what your state laws are about what the school is required to do, and be able to advocate for you and for your child.
Yeah, this is very helpful. Thank you, first of all, for mentioning the therapies that your son has undergone, because I think that might help somebody who hasn't heard of these therapies. And then thank you for mentioning about how do you even tell if there's a problem? Missing milestones, you got the nail on the head right there. That's what the pediatricians are always asking you about those milestones for, so they can catch it early. And you talked about early intervention. You're absolutely right. From birth to 3, that's when early intervention's important and available. Once you miss that window, then you're going to have to deal with the school system. And that IEP, the Individualized Education Plan, is basically a plan for educating someone who has challenges in the school system. And you've kind of missed out on an opportunity for help in the birth to 3 category, where there's also services. And yeah, for anybody listening, talk to your pediatrician or your healthcare provider, get involved in early intervention, and just get all the help that you possibly can and form bonds with other moms that are going through it at the same time. As you've heard Christina talk about, this is something that it can be a lonely journey when it's your first child. It can be especially hard because you don't know any different. And to have support and services means all the difference, not just for us as parents, but also for the child's ultimate outcome and success.
100%.
Some of the things that I experienced, just from my standpoint, I don't want to take over the conversation, but obviously my son had communication problems. He got diagnosed with autism at the age of 2.5, and like you, I had another baby right away. I had my kids almost 26 months apart. It was 25, almost 26 months apart. So I've got a breastfed infant on my lap, feeding while I'm getting the news handed down to me. And then not even an hour later, my husband had to go on a business trip, so we're saying goodbye. He's going off to the airport, and I'm trying to figure out what just happened. It's what happens. He had repetitive behaviors. For example, he used to play with pots and pans and balls, and he would take 5 little toy balls and put them in this pot and put the lid on, take the lid off, take the balls out, and then start all over again, put the balls in, put the lid on, take the lid off. And it was kind of maddening to watch. And he would spin wheels, which is a repetitive behavior. He had the motor delays. Like I said, he couldn't even hold a baby bottle until he was 11 months old. And we didn't know any better because we didn't know babies were supposed to hold a bottle as soon as they're able to. Make that kid work, right? We already talked about a lot of the other stuff like speech issues. Eye contact was an issue for my son. I don't know about you. What was your experience with that?
Yeah, so absolutely. I think that was when we started noticing things were a little bit off when he was young, because he wouldn't look at you, right? Or like he wouldn't respond, and we couldn't figure out why. And so, yeah, so that's definitely something that we've worked really hard with. And so, like now, like if he'll like, I call him Prince Alex because he's like, he like barks orders at me like I'm his, like I'm his servant. And I'm like, dude, you need to look at me. Like if you want me to do something for you, you know? So, it's like the royal we, like, we need this, So it's so funny, but I'm like, no, you need to look at me. If you want me to do it, you need to look at me. You need to connect with me. You need to connect with my eyes so that I know that you are asking me. And again, this is something that we take for granted, that it's a normal behavior. Of course, you're going to talk to the person and you're going to look them in the eye. This is something that's challenging for children who are on the spectrum, or even adults that are on the spectrum. I mean, I think about Amy Schumer and the fact that she's spoken very openly about her spouse, and that
Mhm.
like there are things that he does that she's like, what the, but like it's something that they've talked about openly. And obviously he's very high functioning, but like it's also something that they talked about because they have a son. So it's like, you have a parent who's on the spectrum. What's the possibility of your kid being on the spectrum? We also know it's more common in boys than in girls. So like all of those things, makes you wonder. And the eye contact is a big one. And that, again, going back to that emotional intelligence and being able to engage and to look at others and to empathize and to see those nonverbal cues, which is very challenging, sometimes for kids on the spectrum.
Right, absolutely. And I think that if anybody is concerned, anybody listening to this, there might be some pharmacist moms or pharmacist dads or technicians or students listening to this. I, in particular, went with my pediatrician at first, got referred to a developmental pediatrician, got the diagnosis from a developmental pediatrician. Would you mind saying who diagnosed your child? What kind of a practitioner?
It was our pediatrician. And then obviously for us to be able to get additional services, we need to go to a psychologist. And so there's like
Okay.
very specific rules about like qualifying. And so like we're still on a wait list and my kid's almost 6.
Oh, wow.
So it's been really hard because like so we have a center here, And there's like two in the whole state. And so
Oh,
there's like
wow.
it's like a year and a half waiting list. And then with COVID, everything shut down. So like that was when we were trying to get all of his stuff evaluated. Cause again, this was now almost 3 years ago. So he was 3.5. So stuff has really been out of whack. So we're
Waiting lists
treating
are
him as
for
if,
real.
yeah, like, so we're treating him as if he has an official diagnosis, but we actually don't have the official diagnosis. It came from a pediatrician and not a developmental specialist. So,
Wow, that is amazing. So he still doesn't have an official diagnosis, but your pediatrician said he's got the hallmarks, the milestones haven't been met, and all that. All right, I see you shaking your head. That's crazy. In Ohio, I actually had to go up to Michigan. I had to go to Ann Arbor, Michigan. I live near the Ohio-Michigan border anyways. I was living in Toledo, Ohio at the time, which is maybe an hour from Ann Arbor, Michigan. I'm an Ohio State fan, but I'm a big fan of the medical system up there at U of M. No animosity towards them. And anyways, the types of I guess practitioners that can diagnose autism, according to the website that I looked at, autismspeaks.org, was a developmental pediatrician, a child psychologist or psychiatrist, a pediatric neurologist, can be referred by a pediatrician to a developmental pediatrician, child psychiatrist or psychologist, pediatric neurologist, and that's it. So those are people that are in demand clearly, and apparently you guys don't have enough of them in your area. I'm so sorry you have to wait.
it's definitely been a struggle for sure. And obviously, juggling all of that with another child and a career and trying to make sure that I'm, meeting the basic needs of my family unit. Not to mention, I had my grandmother pass away right at the beginning of COVID. Have a mom that is, struggling with all of that, and then recently found out that my estranged father also passed away. We did not have a relationship, but I just found that out in February. So there's
Oh
just been
my
a
goodness.
lot of turmoil. So if I look like I have it together, I am here to tell you that that is not true, and that most days I am on the struggle bus. And depending on the day of the week, I may be closer to the front of the bus or the back of the bus. So if you're not sure, just ask, "How are you?" And I might actually tell you. So, that's the pleasantries of life, right? Like, someone asks you, like, how you're doing, they may say, "Oh, I'm fine." But for me, like, that authenticity has been very important to me, and I no longer do things that don't give me joy. And so if somebody asks me, like, how I'm doing, and if I am not doing well, I will tell you. Like, I will tell you exactly. Like, "No, I'm not in a good space today," or, "No, like, I have a bunch of deadlines that I haven't met, and I feel like, nobody's gonna ask me to do anything anymore because I can't get stuff in on time, and I say yes too much, and I try to be everything to everyone and keep a smile on my face and be super optimistic. But some days I just literally want to crawl back in my bed and be like, nah, I'm done adulting today.
Same, same. Oh, you are such a breath of fresh air. It's so nice to talk to somebody who keeps it real because I think we all should do that more often and admit that we struggle. On my podcast, I talk all the time about how I struggle and I just really don't have too much time to work. I'm a very capable and intelligent person, and that leads to me wanting to work, and I do work when I can, but when school is canceled, this is not a problem you would have in Nevada, but due to snow, we have snow days out here in Ohio, it kills me because that's it. I can't work anymore. Or like today, it's spring break. I sent my son with my other son out to Chick-fil-A. And sometimes a 17-year-old, almost 17-year-old, has to watch his 19-year-old brother. And it's okay. I mean, it's legal and everything, but without that help, I would really struggle more. And I appreciate, again, your authenticity talking about that. Back to diagnosis and not having one yet, I just want to put this out there for anybody who may feel like they don't want a diagnosis. Diagnoses lead to treatment and services. And I got to tell you, a lot of doors opened once my son got his diagnosis. And earlier, much earlier in this conversation, you talked about how expensive things are. Once you have a diagnosis and you can get on the waiting list for Medicaid and other forms of financial assistance, the earlier the better. It took me 15 years for my son to get on Medicaid, or his 15th year of life, he got Medicaid. I think it took 13 years to get that. And once we got that, that was a game changer because then we could better afford those services. For example, by the time he got Medicaid, I think 4 months later, maybe 5 months later, he had to have his wisdom teeth extracted under sedation, full sedation. And they also did x rays and a full exam and stuff. $56,000. I would have owed quite a bit. I mean, my husband's insurance covered some of it, but these services are not cheap and it's scary.
Yeah, it's definitely what motivates me to continue to take on additional projects and to develop new streams of income.
Absolutely. Absolutely. All we want is for our children to be as independent and fully developed as possible. And we know, don't we, that there are certain skills they just may not develop. There might be gaps. I love your husband's analogy that you brought up of having like a computer that, there's just a cartridge missing. For example, my son has no sense of imagination. He does not understand making things up and having an imagination. So if we talk about something or watch a movie where there's the imagination that's brought up, he doesn't get it. And he still watches. I mean, especially if there's a movie with music, he'll still continue to watch it. But I just, I love that you brought up all these points because this is my life too. And you're speaking my language. Thank you.
Well, you're very welcome. And again, I think knowledge is power. And I think that the more we speak up and speak out, the more it becomes socially acceptable. Because I think the last statistic I saw was like 1 in 25 kids has some form of either spectrum or some type of, cognitive issue, which is just crazy to me. Like that just seems so high. But apparently, it's a lot more common than people like to discuss. And, we're not sure why it's happening. But I think it's less about the why and more about the what can we do now, and be more forward thinking and be more progressive, and have a more inclusive society for these children, because they're children now, but they're going to be adults at some point, and they need to have space within our society in order to be productive
Mhm.
members and to be able to contribute. So I think we really do need to do a better job of educating everyone about the challenges and that everybody's different. And again, there may be a cartridge missing, but that doesn't make them any less human and any less desiring of love and affection and care. And so that's what I aspire to, is to not only make a safe space for my child, but that my child feels loved. And I think that is the number one thing that I am most proud about, is that for all intents and purposes, with all of his challenges, my child is happy. He is so happy. He is such a happy child. He has the best laugh and he
Yay.
smiles all the time, and he loves his sister and he loves his dad. And, sometimes mom is maybe not as understanding as she should be, because she's looking at this as a personal, attack on her being, which she shouldn't. And I still struggle with that. But this child is loved, and I feel blessed that we are his parents, because if he had had other parents, I don't know if they would have been able to deal with the situation the way that we have.
Fair points, all well made. And I give you a lot of credit. You are doing a fantastic job. Being a mom is a thankless job. And I know that from one mom to a next, it means something when another mom says, "Hey, you're doing a good job. You got this." Because we need to hear that. Because like you said, we ride the struggle bus sometimes. And in order for us to go to conferences or do podcast interviews or even go to work, we need support systems. Mine's my husband, the school, sometimes my younger son, grandparents. Caregivers are really hard to come by for us. And, we can't do it without support. So you're doing great. You've got good supports in place and just keep going. Just keep going.
Yeah, I mean, well, and I'm not going to say that I don't have hard days, because I do, where I struggle with him. I struggle with, his ability to like self-soothe. We do a lot of meditation in the house. We do a lot of mindfulness. So that's also something that I think is maybe an alternative to some of these other therapeutic interventions. But my son does a very good job of self-soothing, and part of that is because he watches TV, and they're on Nickelodeon. They have this whole thing about kids meditating, and so he learned from that, and like the
Cool.
breathing exercises. And so we've basically tried to help him with that and to increase his awareness around that. And so we'll tell him, let's be calm, let's breathe. And so he'll self-soothe. He'll do that on his own. But those are the coping things that we try to give him. We try to give him those tools so that when he's not with us, he doesn't have a full-blown, episode. And again, goes back to that just love and care, and making them feel safe, and understanding what their triggers are, and knowing that some days you're going to have good days and bad days, and that's okay.
Yeah, these are all good points. Those coping skills are important. I love that you brought that up. And I'm so glad that he has ways to self soothe. That is something that my son has learned over time, but it also is one of his repetitive behaviors that soothes him. And I think that's what a lot of kids with autism are doing when they do their repetitive behaviors, whether it's echolalia or spinning something or putting balls in and out of a pot. They're soothing themselves, right? Yep. But yeah, thank you for sharing that because coping and self-soothing behaviors are all part of autism. They're part of being a human too. I mean, gosh, when we have rough days, what do? We do something we like, right? And we do it a
Yes.
lot.
Yes. So, getting in the bath, or having a glass of wine, or, going to a movie, or, doing a Netflix binge. There's all kinds of different things that we
Yes.
do to self-soothe. So, I live in an entertainment capital. So, there's lots of things to do in Vegas. So,
Absolutely. Yeah. Gosh, it's been a good 5 years since I've been there, but next time I'm in town, I'm going to look you up. I hope we can get together.
open invitation anytime.
Thank you. Thank you. Yes, we'll have to do some of those self-soothing behaviors together.
Ooh, that sounds promising.
Yes, definitely. It'll be fun. As you've gone through your journey of being a parent of a child with autism, what are some of the resources that you've found yourself using, or anything that you would recommend for a parent of a child who is yet to be diagnosed or just newly diagnosed?
Well, I would say I would look at your individual community, because a lot of the stuff is like hyper local. And so we have organizations here in Las Vegas. You mentioned Autism Speaks. I would encourage you to talk to your pediatrician. Most of the pediatricians that I know of have a list of resources that they can provide you. So, like, my pediatrician provided us with like an autism friendly dentist, which is a big deal, right?
Mhm.
And then
Yep.
like places for therapy. We use a place called the Lovaas Center, which is one of many places that offer ABA services. We go through an independent provider that is a speech and a feeding therapist. So she does both when she comes and does his sessions. And so, I think asking what resources are available in your area is number one, because some of the national organizations may or may not have some of that information. And then also, I would say understand what your rights are as a parent. So read all the documents. Everything that you have, know what your legal rights are, and what your rights are to services for your child once you have that diagnosis. I think that's kind of one of the biggest things that I've learned, is like knowing your rights as a parent is hugely important, right? And understanding like what services your kid may or may not qualify for, and what you may have to supplement with. and then, getting them involved in sports and activities that are specific to kids on the spectrum, and ways that they can interact with typical peers as well as peers that are also on the spectrum. So I think those kinds of things and organized sports helps them with that social and emotional development, that can really help out, especially if you choose to homeschool your child.
All good points. Yes. I like what you were saying about the sports and going places where they include others with challenges. For example, my local YMCA used to have a T-ball team, and my son Kraig, he didn't necessarily know what was going on, but they were four and we all figured it out together and helped him, and the coach would run along the bases with him and everybody had a good time, and I think he learned about taking turns and expectations and things like that, and we just have to repeat those experiences until our children learn. And one of the hard things as a parent is knowing when to let something go. For example, developing an imagination. I was really hoping he would develop an imagination because, I mean, you can get lost in your own imagination, right? That can be a coping skill, a self-soothing skill, but he never developed it. And knowing when to let go can be hard, but as a parent, we need to learn these things.
Having those realistic expectations and not letting them steal your joy, I think is really important.
Absolutely. Thank you for sharing that. Yeah, I think gosh, we're coaching these moms that might be listening or others who also have children on the spectrum. So, yeah, thank you for speaking your mind. Now, I'm going to go back to our professional lives for a minute. I'm going to go back to us as pharmacists who have these unique careers. So, how has having a child with autism affected your career?
Well, I think it motivates me. I think that's the number one thing, is that it motivates me to, as I mentioned before, take on alternative projects. It also motivates me to help underserved communities because I have a child with special needs, and to advocate for, individuals of color and marginalized communities. And then also, it's really motivated me to develop additional streams of income, because his therapy services are not cheap. And so, I would say that the number one thing is that it motivates me. It motivates me professionally, and it motivates me personally, to be a better mom, because whatever I do, I want to be able to spend more time with my kids.
Thank you for sharing that. I appreciate that. And I just want to give you a lot of credit for having this kind of a reverse than traditional relationship where you are the breadwinner, your husband's the stay at home dad. That's pretty cool. I'm so happy for you that you have found a way to make that work and it works for your son and daughter, especially. And, you deserve a lot of credit for finding something that works, even though it's not traditional. So, not only do you have this cool non traditional job, but you have this non traditional support system and it's working for you. So, congratulations on your success there.
Yeah, thank you. I mean, it was definitely a hard decision going from a two income household to a one income household. But when we looked at it just from the standpoint, so basically what we did was my husband took a vacation from his job, and in that time, my son went from not speaking to speaking.
Ooh,
And so, like, it was a pretty clear decision that, like, him being more present was, there was no other option at that point, and then obviously looking at it from a financial standpoint, we had to give up some things, but from the standpoint of what we gained and that peace of mind of knowing that, like, my children were being taken care of by their father and not a stranger. And then also that he was able to support him from those additional needs and therapy needs. And he would take him to his therapy appointments and all those things before we started getting services in the home. That alone was worth it. Like, regardless of anything else, like, just that peace of mind and knowing that, like, was worth the financial, hit that we took. And so, obviously you need to be with a very strong partner to take that step back. But I tell him all the time, he has a much more difficult job than I do. And I praise him. I tell him all the time how much I appreciate him. And, I give him time to do the things that he wants to do. And I never question anything because I know all of the things that he does in order to make our family unit work.
Yes, much respect to your husband. I serve that role for my husband, and it is not easy, and you have to give certain things up. But the trade off is my husband feels supported, kind of like you feel supported, and our children are definitely well taken care of. I've kept him alive this long, Christina. I'm going to keep on going.
Yeah, no, some days that's like the litmus test. It's like, did nobody die? Nobody died today. Woohoo! Like winning, right? Like,
Yeah, yeah. Yeah. Well, as we start to wrap this up here, what can you say are some of the gifts that autism has brought you and or your family?
well, I think it's really given me the gift of time, right? Like, I don't know if both my kids were typical, if I would have dedicated so much time with them, right? And so I think we as parents forget that our children grow quickly and like this time we'll never get back. The other thing too is that we take a lot of videos, and I don't know if we would do that if my son wasn't on the spectrum, right? So we do a lot of videos so that he can see and model behavior. And so sometimes we look back at those videos and I'm like, "Oh, my kids are so cute and so little," like so certain things that I don't think we would have done just to document our lives if we didn't have a child on the spectrum, right? And it's things that, being more present, being more in the moment. I think I would see myself doing that, but I don't know if I would see myself doing that as much as I do now if I didn't have a kid on the spectrum. And the fact that like I really engage with him. I sit, I listen, I put my phone down, like I have to, because otherwise he'll be distracted. And so like being in the moment, being present, I think is one of the biggest gifts that it's given me. And that, having that time that you wouldn't ordinarily say, be with your kids, and how important that is to them, because they see that. And then just also just how loving and caring their parents are. Because that's the other thing that happened because of my child being on the spectrum, is that his dad is at home with him and he sees the love that his parents have for each other because they're around each other all the time. And that wouldn't happen if we were in a two-income, two-working parent household.
Yeah. Hashtag gifts of autism, right? Absolutely. Yeah, I think having a child with challenges has caused my family to become closer, and we work together more than I think we ever would have before. Having a 19-year-old, he's now 19 with autism, is different from having a typical 19-year-old. If he were typical, he would be off at college right now, and a lot of his same age peers are off at college right now. So I look at my friends' Facebook feeds and I see everybody in their freshman year of college or sophomore year, whatever it is. And I don't regret what we have. But I think, some of those moms might love to have their child at home, and I still have that. So I'm just going to look at the bright side, enjoy that, and like you, just enjoy the hashtag gifts of autism.
Yeah. And again, not letting the things that you can't control steal your joy.
Good point. Very good. Well, Christina, as we wrap this up, is there anything else you'd like to share today?
For all those moms out there that are struggling, just know that you are strong, you are capable, and you are enough every day. And to speak your voice, because you never know who's listening and may need to hear your message.
Excellent. Thank you so much for sharing that. And thank you for sharing how you use your voice as a parent of a child with autism and an advocate for him here today on the Pharmacist Voice podcast. Take care.
My pleasure.
Thank you for joining me for episode 146 of the Pharmacist Voice podcast. Please visit thepharmacistvoice.com to read the show notes. I'll have links to Dr. Christina Madison's LinkedIn profile, Autism Speaks, the Autism Society, the CDC, and more in those show notes. If you know someone who needs to hear this episode, please share it with them. And subscribe to or follow the Pharmacist Voice podcast on your favorite podcast player and YouTube to get each new episode right when it comes out. Join me next week for episode 147. I'll be recapping some of the major talking points from my interview with Christina, such as diagnosis, treatment, resources, and more. Plus, I'll share how autism has changed my life. That's all I've got for you today. Thank you again for listening.